Next thing we have to talk about is the hypoglossal nerve, the 12th nerve. And what about that? See, this is one question asking us about the 12th nerve injury, hypoglossal nerve injury. Understand, it's a pure motor nerve and does not present with sensory loss. So immediately you will get your answer. 12th nerve is a pure motor nerve, so it is not presenting with sensory loss. Immediately you will get your answer. It's here. Why this is the answer? You know what is tactile sensation? The journal sensation. You know who is carrying the journal sensation from the anterior 2/3 of tongue? Lingual nerve, branch of mandibular nerve, branch of trigeminal nerve, if you remember. Remember, tactile is journal sensation, so journal sensation from the anterior 2/3 of tongue will be carried by lingual nerve, branch of mandibular nerve, branch of trigeminal nerve. It is not hypoglossal. It's a pure motor nerve, hypoglossal. So answer is choice number C. Yes. And how will you explain the other choices? Like choice number B. Yes. I will explain it with the help of discussion on genioglossus muscle. Genioglossus, the tongue muscle. Yes. So this happens because of some genioglossus problem. Yes. Can you discuss the genioglossus problem then? Yes, of course. Can you explain why this is happening? If you're telling tongue is deviating to the same side of lesion, why the larynx is deviating to the opposite side of lesion? Explain. In hypoglossal nerve injury, say right-sided 12th nerve injury, and tongue is deviating to right side, but the larynx is deviating to left side. Why the larynx is deviating to left side? It is a statement given by Gray's Anatomy. Yeah, of course, Gray's Anatomy. Somebody has read Gray's Anatomy, put a question, but why? Explain why. That we will have to do, but keep your answer as choice number C. Then you will discuss D also? Yes. And B also? Yes. Let us start with B. If you remember, we have known that the 12th nerve nucleus is at the floor of the 4th ventricle in the upper medulla near the midline. Do you remember that? The nucleus of 12th nerve is near the midline, affected in medial medullary syndrome, tongue muscle palsy. It is at the floor of the 4th ventricle. And giving the nerve which is exiting, between the two structures. What is the two structure? Anteriorly you have the pyramid, and posteriorly you have the olive. So it is sandwiched between pyramid, olive. Yes, if you remember. Most anterior, pyramid. Then you have the 12th nerve. Then you have the olive. It is between the two structures, sandwiched between the two. And what is it doing? What it is doing, it's supplying tongue muscle. Okay, tongue muscle, right. Now what? If the tongue muscles are paralyzed, see, it is supplying tongue muscles, could be intrinsic or extrinsic muscle of tongue, could be styloglossus, hyoglossus, genioglossus, but it is not supplying palatoglossus. Why? It is not supplying. Why it is not supplying palatoglossus? Because palatoglossus is supplied by the nerve of palate. Who is that? Cranial accessory nerve, vagus accessory complex. So you are telling that 12th nerve will not supply palatoglossus? No, it is supplying some other muscles of tongue, styloglossus, hyoglossus, genioglossus, etc. What if it is lesion? Where? On the right side. If it is lesion on the right side, then the tongue will deviate to right side. Why the tongue will deviate to right side? Explain. I can explain this according to genioglossus muscle. What about genioglossus? What is genioglossus? If you remember, we have discussed one thing. Lateral pterygoid will aim the tongue. What is aim the tongue? Lateral pterygoid will aim the mandible. The lateral pterygoid will aim the mandible. What is that? Taking the mandible anterior and inferior and medial, and both the lateral pterygoid can cancel each other. If the right lateral pterygoid is not working, then the left becomes more powerful and pull the mandible towards the same side of the lesion. Similarly, remember, genioglossus muscle is the muscle of tongue. It will aim the tongue. means it will take the tongue anterior and inferior and medial. Yes. As the lateral pterygoid will aim the mandible, and if the right muscle is not working, mandible deviate to right side. Similarly, genioglossus muscle, you see, it is taking the tongue anterior and medial also, and inferior also. You are telling that it will protrude the tongue in the midline? Yes, if both are working. If both of them are working, then they protrude the tongue in the midline and depress the tongue also. Genioglossus. And what if one of them is not working? Which one? The right-sided. So now you're telling that right genioglossus is not working. Right hypoglossal nerve injury? Yes. Then they cannot balance each other. And there will not be a nut protrusion in the midline. Then what will happen? If the right genioglossus is not working, then the left is more powerful. Keep pulling tongue to midline, 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 and cross the midline, and tongue will deviate to the same side of lesion. See? The left genioglossus became more powerful. And when the left genioglossus became more powerful, cannot be balanced with the right side, he'll keep pulling tongue to midline, and then tongue will deviate to the same side of lesion. This is the diagram which we are supposed to draw now. We are asking our patient, show me your tongue, protrude your tongue. And the patient is doing that. So patient is protruding the tongue now? Yes. Anteriorly? Yes. Using both the genioglossus? Yes. And when both the genioglossus are working, what do? They aim the tongue. Aim the tongue means they will protrude the tongue in the midline. So there will be a net protrusion in the midline? Yes. And the genioglossus will aim the tongue means they will take tongue anterior, inferior, and medial. Yes. Means they are not only protruding, but they are also depressing. Yes, that is what, aim the tongue. Now, as the genioglossus muscle are taking the tongue anterior, inferior, and medial, protruding and depressing in the midline, it is called as safety muscle of tongue. Why? Because it is preventing the tongue from falling backward into the respiratory tube. It is preventing the tongue from falling backward into respiratory tube? Yes. Why? What will happen when the tongue will fall backward into respiratory tube? Why it is called safety muscle of tongue? See, because it is protruding the tongue, it will prevent the tongue from falling backward into respiratory tube. That's why it is called safety muscle of tongue. But when do we require that safety? Say, for example, you had a case of, yes, post-epilepsy, unconsciousness, or some patient was undergoing epilepsy and then now he is unconscious. Yes, what do you do now? Two things. What? Number one, I'll turn him to one side. Turn the patient to one side. Yes. Number two, put my finger into his mouth and pull the tongue outside. Pull the tongue outside. That is what we do. Yes. You are having a post-epileptic unconscious patient now? Yes. So you will turn the patient to one side. Yes. And then you pull the tongue outside. Why? Because otherwise tongue will fall into respiratory tube and there will be asphyxia and patient will die. Oh, there will be asphyxia and patient will die? Yes. I don't want my patient to die. Why the tongue is falling backward? Because patient is unconscious. So what? Genioglossus has a drive. So it is a skeletal muscle basically. It's a skeletal muscle, but this skeletal muscle need a drive from the CNS. So it is having some drive from the CNS, yes, and it keeps working, yes. But if it is deep unconsciousness, then the drive may not be there. So if it is deep unconsciousness, the drive may not be there, yes, and the tongue may fall backward, yes. That can happen in such a case. That's why you have to pull the tongue outside. Otherwise, you're sleeping, you're unconscious. You're sleeping and you're unconscious. Then you don't put your tongue, finger in the mouth and pull the tongue out. Why? Because during sleep, the drive is still maintained. You are unconscious, but you're not deeply unconscious. So you're telling that while sleep, skeletal muscles still work. Yes. Genioglossus still work because there is some CNS drive, yes, but it will be lost if it is deep unconsciousness, could be in such case of post-epileptic unconsciousness. Okay, fine. What about sleep apnea syndrome? Sleep apnea syndrome, yes, actually. The culprit muscle is genioglossus. You are telling that in sleep apnea syndrome, the culprit muscle is genioglossus. Why? Because it is postulated that in sleep apnea syndrome, genioglossus drive is reduced. So whenever the patient is sleeping, the tongue falls backward into respiratory tube, patient wakes up in the night, again sleep. And when the patient sleep, he become unconscious, the drive to the genioglossus goes down and the tongue will fall backward and there will be difficulty sleeping. He'll wake up. So there is a sleep wake up cycle all the time. Yes, sleep, wake up, sleep, wake up. So it will keep happening. You mean to say patient was sleeping and the drive goes down? Yes. And genioglossus is not working? No. So tongue falls backward and difficulty breathing and patient wakes up? Yes. And again he sleeps? Yes. And again the drive goes down? Yes. So what do we do? What we do is we do prosthetic surgery to enlarge the respiratory tube to help the patient sleep. So you are doing prosthetic surgery to enlarge the respiratory tube to help the patient sleep? Yes. And we are also developing a pacemaker for genioglossus. You are developing a pacemaker for what? For genioglossus. You mean to say you will put a pacemaker in genioglossus which will keep activating genioglossus while the patient was sleeping in a sleep apnea syndrome? Yes. Experiments are going on. In a case of sleep apnea syndrome, there is a theory. You can put a pacemaker in genioglossus which will keep the drive of genioglossus intact and the patient will sleep comfortably. Till that time you develop the pacemaker, keep doing this surgery which is enlarging the respiratory tube, prosthetic surgeries to help patient with sleep apnea syndrome. But the culprit muscle postulated is genioglossus losing its drive as the patient becomes unconscious while sleeping. Now what about that patient who you told about right 12th nerve injury? That patient, yes. Actually when right side 12th nerve injury is there, right genioglossus is not working. So left became more powerful. So when the left is more powerful, it will keep pulling the tongue to midline and tongue will be pulled to right side. You are telling that right side 12th nerve injury. Yes. Right genioglossus is not working. Yes. And left became more powerful. Yes. It cannot be balanced now. No. So it will keep pulling tongue to midline and cross the midline. Yes. And tongue will deviate to the same side of lesion. Yes, that was the discussion. Okay, what about the larynx? Why the larynx will deviate to the normal side, left side? I can understand why the tongue is deviating to right side, but why the larynx is deviating to left side in hypoglossal nerve injury? What is the 12th nerve supposed to do with larynx? Explain. That will explain by discussing ansa cervicalis. What is that? Ansa means loop. Where? In the neck. So you have some loop in the neck, nerve loop. Yes. Why do you need this nerve loop? To supply muscles of anterior neck. So there are some muscles in the anterior neck which will supply by a nerve loop here. Yes, ansa cervicalis. Oh, you want to discuss that nerve loop now? Yes. Okay, discuss then. Let us discuss some anterior neck muscles first. Like which one? Can you see this is front view of the hyoid bone? Yes. Front view of the thyroid cartilage of larynx. Thyroid cartilage of larynx front view. Yes. Sternum bone front view. Clavicle bone front view. Scapula bone front view. So this is scapula bone front view. Yes. I think scapula bone is giving some muscle to hyoid bone. Yes. That is the scapula bone giving muscle to hyoid bone. This is called as omohyoid muscle. Now if you say scapula bone give one muscle to hyoid bone and it is called as omohyoid, it has an inferior belly and it has a superior belly. So maybe it is inferior belly, superior belly, but they are supplied by ansa cervicalis in the neck region. So ansa cervicalis supplying some anterior neck muscle. They are omohyoid muscle, one of them. Yes. Okay, then what is the other muscle it is supplying? It is also supplying this sternohyoid muscle. What is that? Sternohyoid. Sternohyoid means coming from sternum bone to the hyoid bone. Yes, sternum bone to the hyoid bone. That's why the name is sternohyoid. So sternohyoid is the anterior neck muscle supplied by the ansa cervicalis. Yes, but remember, some muscles are not supplied by ansa cervicalis. And who is the anterior neck muscle not supplied by ansa cervicalis? That is here. Who? This one. Who is this one? This. What is this? This is thyrohyoid muscle coming from thyroid cartilage to hyoid bone. So there is some thyrohyoid muscle coming from thyroid cartilage of larynx to hyoid bone. It is not supplied by ansa cervicalis? No. Then who is supplying? That we have to find out. Let us find out. Let us discuss two muscles which are supplied by ansa cervicalis and two muscles which are not supplied by ansa cervicalis. Oh, one of them is thyrohyoid. Yes. Then who is the other one? Other one we'll find out. It is geniohyoid. So thyrohyoid and geniohyoid. Yes. Thyrohyoid and geniohyoid are not supplied by ansa cervicalis? No. You want to discuss about them now? Yes. Okay, then let us do that. This is the muscle which is coming from scapular bone to hyoid bone. It is supplied by ansa cervicalis. It has inferior superior belly of homohyoid. This is the sternohyoid muscle which is supplied by ansa cervicalis. But then ansa cervicalis was not supplying the geniohyoid and thyrohyoid. So where is the geniohyoid then? You have seen only thyrohyoid. Where is geniohyoid? We'll draw that. Let us draw that. So you want to draw that now? Yes. Okay. What will you draw? Midline of the body. And this is midline of the body and this is front view of the mandible bone. If that is the front view of the mandible bone, then what is below that? Front view of the hyoid bone. If that is the front view of the hyoid bone, then what is below that? Front view of the thyroid cartilage of larynx. Front view of the thyroid cartilage of larynx. What is below that? The sternum and clavicle bone and scapular bone. You are talking about various bones here. What is this bone? Sternum in the midline. What is that? Clavicle bone and scapular bone. The scapular bone gave a muscle which is attaching to hyoid bone and it has two bellies, inferior belly and superior belly. Are you talking about omohyoid muscle? Yes, omohyoid muscle having superior belly, inferior belly. So you are telling that this is anterior neck muscle coming from scapular bone and coming to the hyoid bone having inferior belly, superior belly of omohyoid. Fine. What is the other one you have discussed supplied by ansa cervicalis? That was coming from sternum to the hyoid. So we are telling sternohyoid muscle, and sternohyoid muscle is also supplied by ansa cervicalis. Now, two muscles supplied by ansa cervicalis and two we want to discuss which are not supplied by ansa cervicalis. Which one? You have already known the name. One is here. Who is this? This is called as the thyrohyoid muscle. If you say this is the thyrohyoid muscle, then there was one more and it came from the mandible, actually the genial tubercle of mandible. So if it is coming from genial tubercle of mandible, the name is geniohyoid muscle, both attaching to hyoid bone. You are telling that there is some genial tubercle on mandible bone? Yes. And that genial tubercle giving geniohyoid muscle to the hyoid bone? Yes. And then thyroid cartilage giving some muscle, thyrohyoid to the hyoid bone? Yes. These two muscles of the hyoid bone are not supplied by ansa cervicalis. Then who is supplying? Who is supplying them? That we have to find out now and mention that this is C1 fiber of spinal cord. They will supply. So C1 fibers of spinal cord will supply the two muscles, namely the geniohyoid and thyrohyoid. Yes. How? How C1 fibers of spinal cord will supply these two muscles? Tell me. Actually, C1 fibers of spinal cord is asking 12th nerve. What it is asking 12th nerve? It is asking 12th nerve. 12th nerve? Yes. Are you going there? Where? Towards the tongue to supply tongue muscle? Yeah, I am going there. I have to supply tongue muscle. Can you do one thing for me? What? What do you want? The C1 fibers of spinal cord are asking the 12th nerve. 12th nerve? Yes. Where are you going? I am going to supply tongue muscle. Can you do one thing for me? What? Can you carry my fibers? Carry your fibers where? It is asking the 12th nerve to become a vehicle. So now the 12th nerve will become a vehicle? Yes. The 12th nerve become a vehicle to carry C1 fiber of the spinal cord. Now, if you are telling that C1 fiber of the spinal cord is carried by 12th nerve, what is the purpose of that? Purpose is to supply two areas. To supply two areas, what are the two areas? Tell. If you are telling that C1 fiber of spinal cord is using 12th nerve as a vehicle to send axons to the two areas, what are the two areas? Number one, supply these two muscles. Oh, you mean to say genohyoid, thyroid, which are supposed to be supplied by C1 fibers, were carried by 12th nerve? Yes. And what is the other supply? Other supply is it is forming. What is the other supply? Other supply is it is forming, yes, superior root for, yes, it is forming superior root for, yes, what is called as the ansa cervicalis. Ansa cervicalis is a nerve loop in the neck, yes. And you are telling that ansa cervicalis, the nerve loop in the neck, is having a superior root, yes, and that superior root is contributed by C1 fibers carried by 12th nerve, yes. Remember this. C1 fibers of spinal cord contribute to the superior root of the ansa cervicalis. And what is ansa cervicalis doing? Ansa cervicalis is supplying anterior neck muscles. Oh, it is supplying some anterior neck muscles like we have discussed here, like this omohyoid and the sternohyoid. Yes, omohyoid and sternohyoid were supplied by ansa cervicalis, but ansa cervicalis was not supplying genohyoid, thyroid, because they were actually supplied by 12th nerve carrying the C1 fiber. So ansa cervicalis has supplied two muscles, namely omohyoid and thyroid, but it has not supplied two muscles, namely genohyoid, thyroid, because they were supplied by hypoglossal nerve. Now, there is a superior root of ansa cervicalis contributed by C1 fiber carried by 12th nerve. What about the inferior root? If you want to talk about inferior root, I'll tell you. Inferior root is C2 and C3 spinal cord, and this C2, C3 spinal cord is contributing to inferior root of ansa cervicalis directly. So you're telling that C2-3 spinal cord directly will contribute to inferior root of the ansa cervicalis so that they can also supply some anterior neck muscles? Yes, anterior neck muscles are C1, 2, 3 supply. So anterior neck muscles are C1, 2, 3 supply. Yes, and they are getting C2, 3 by this inferior root of ansa cervicalis. Yes, okay. Now, once you have understood, understand one more thing. Anterior neck muscles are important to stabilize the larynx. What is it? To stabilize the larynx. How they stabilize the larynx? By attaching to larynx cartilages like the thyroid cartilage of larynx. You are trying to say anterior neck muscles are stabilizing larynx by attaching to some larynx muscle like larynx cartilage like thyroid cartilage? Yes, that is why. What happens is, when the 12th nerve was injured on the right side, this C1 fibers were compromised, because if you damage the 12th nerve, C1 fibers were compromised. Not only these two muscles were paralyzed, which are genohyoid and thyroid, but also some more anterior neck muscles were paralyzed. But why the neck muscles paralyzed? This is 12th nerve injury. Yeah, maybe it is 12th nerve injury, and of course it will paralyze the tongue muscle on the same side, but it will also paralyze some more muscle. Why? Because when there is a 12th nerve injury, the C1 fibers were also injured. So some anterior neck muscles were paralyzed. Which one? Not only genohyoid and thyroid, but also some more which have C1 fiber of ansa cervicalis. So when the anterior neck muscles were paralyzed in 12th nerve injury, C1 injury, the larynx is destabilized. And since the larynx is destabilized, it is written by Gray's Anatomy, in 12th nerve injury on the right side, 12th nerve injury on the right side, some of the anterior neck muscles attached to the thyroid cartilage were compromised. Larynx deviate to left side. The larynx will deviate to left side, especially when the patient was swallowing, in swallowing movement, during swallowing movement. So 12th nerve is injured on the right side, yes, but the larynx will deviate to left side, yes, because on the right side some anterior neck muscles were paralyzed. Yes, on the right side some anterior neck muscles were paralyzed, could not stabilize the larynx, so larynx keep deviating to left side as the patient is doing some swallowing movement. Right side of 12th nerve injury, yes, I am doing swallowing movement, yes, and the larynx is deviating to left side, normal side. Yes, this is what happens because C1 fibers injured, anterior neck muscles paralyzed on this side. So larynx deviate to that side. Gray's Anatomy tells that. Follow it.